Alzheimer's disease, the only top 10 death that cannot be cured. Evidence suggests that the process of Alzheimer's disease begins more than a decade before clinical symptoms appear, suggesting we may need to intervene earlier to have a major impact on the course of the disease, particularly when using therapies designed to prevent the development of abnormal protein structures, plaques and tangles, that are abundant in the brains of people with Alzheimer's, according to Heather Snyder, PhD. Current treatments simply improve memory loss and problems with thinking and reasoning on a temporary basis. They boost performance of chemicals in the brain that relay messages from one cell to another, but they don't actually stop the disease from progressing. In 2011, according to the National Institutes of Health, over $6 billion a year on cancer research was spent, $4 billion on heart disease research, and over $3 billion on HIV and AIDS research. But it spends only $480 million on Alzheimer's research, despite the change in the number of deaths from 2000 to 2008. For example, HIV and AIDS deaths were down 29%, stroke deaths down 20%, heart disease deaths down 13%. Prostate cancer and breast cancer were down 8 and 3% respectively. But during that same 8-year period, Alzheimer's deaths were up by 66%. So funding for further research, studies, and clinicals is imperative. Because of the aging baby boomer population, there's a greater focus on the disease now, and hopefully this will help to reel in the money and time needed from leaders, individuals, companies, and researchers who want to find a cure. A few recent treatment options with the possibility to help pave a path to a cure include monoclonal antibodies. These antibodies may stop plaques from forming and help the body clean the beta amyloid from the brain. Monoclonal antibodies act just like the antibodies our bodies naturally produce in response to a foreign body being introduced into our bloodstream or through vaccines. Solanzumab has been found to be more effective when given earlier in the discovery of the disease for those with early stage Alzheimer's. Unfortunately, earlier trials proved that it did not work for those with middle to late forms for the disease. This drug is able to reduce the sticky plaque of amyloid that builds up in the brain. Amyloid collects between the nerve cells, and it causes damages to the brain. If the drug can work by slowing those deposits, it could delay the onset of the disease. And so far, it appears to be safe for the patient, and additional studies are in the works. Aducanumab has shown positive results in preliminary studies. This drug is designed to get rid of amyloid buildup and allow nerve cells to start talking to each other again. More studies and research is currently underway. Saracatinib is a drug originally manufactured for cancer treatment, and it's being tested on Alzheimer's patients. Researchers discovered that beta amyloid interacts with another protein called FIN, and when combined, FIN is overactivated, and that triggers a destruction in connections between the synapses in the brain. In mice studies, the drug turned off FIN, which allowed those synapses to begin working and transmitting messages again. It also allowed memory restoration and reversed brain problems in the mice. Liraglutide has been shown effective in mouse studies, and human clinical trials are underway in the UK on early stage patients. Research has shown that this drug can get into the brain and protect it from deterioration because it can cross that blood-brain barrier. This ability can help protect the nerves, unlike other medications. Researchers believe this is a good sign, and if the trials go well, they expect the drug could be the first of its kind on the market within the next 5 years, specifically to treat Alzheimer's disease patients. 28 million people with Alzheimer's disease will cause a huge financial strain on the nation, not to mention all across the world. With different companies, governments, researchers, individuals, and other groups coming together to share data, funding is now more of a necessity than it ever has been to help find a cure. And then I also want to add that on April 28th, there was some information released about the liraglutide. There was only 38 patients that was in that trial. And it did show that the drug prevented a decrease in energy use of the brain, while those that were on the placebo showed a significant decline in energy use. There was no difference in cognitive tests or amyloid proteins in the brain. However, an Alzheimer's group in the UK is going to fund a larger clinical trial to see if they can get some different results. And they feel very positive that this is certainly a treatment or something that could be started towards a cure in the future. Thanks so much.